Welcome back. Well, just the word colonoscopy can be a bit frightening to hear, but there are huge benefits to getting that screening.
Most insurance companies cover the test, and it is important for you to know that colorectal cancer is treatable and beatable if you catch it early. Dr. Erica Samuel is with GI Associates, and she is here to tell us more about Colorectal Cancer Awareness Month. Great to see you this morning. I have to start by getting to what I think is the most important part, because even when Will Durst, the comedian, was here, he said, yep, I've had my colonoscopy. He's 63. He's had a couple. And he said, just let her know my favorite part is the juice that you drink before. And I said to you, what do you call the juice or the potion or whatever it is that you drink? Because everybody knows you have to be cleaned out before the procedure. And you told us what?
Well, we were just talking about the fact that I usually don't use a specific juice any longer. A lot of our physicians in our practice are actually using just a sports drink with then a medication added to it. It's very well tolerated.
Like Gatorade?
Yes, exactly.
For example, or I don't know what the other names are of sports drinks.
Exactly.
And then you use something like Miralax, which I know I'm using a brand name, but it has no taste.
Exactly. It's very well tolerated. I mean, the preps have come a long way. Even the medicines that we're now using, they're very small volume, very easy to use for a lot of the patients, and we're getting very few people who don't want to do it.
Amazing.
How many people in the U.S. are affected by colorectal cancer, and why is it so important?
Well, it's a really important thing to look at because this is a preventable cancer. There's about 130,000 people who are diagnosed every year, and unfortunately about 50,000 of those are diagnosed at the advanced stages. And when we have something like colonoscopy where we actually can prevent this cancer, it's really important to get the word out.
Absolutely. What about some of the screening guidelines? Because they're a little confusing for some people, because we usually hear at 50 you should have a colonoscopy.
And that's a really good thing to go by. 50 is definitely an age that everybody needs to remember. However, if you have a family history of colon cancer, maybe mom and dad had polyps, brothers or sisters, that's really a reason to start looking at getting screened at age 40 instead of age 50.
So even polyps, even if they were non-cancerous, you should still get screened earlier?
Well, there are different kinds of polyps. So it would be specifically the precancerous kind and at a young age in your parents, not at an advanced age. Usually when people, that's one of the risk factors for colon cancer and for polyps is advanced ages. But we're seeing them really in younger people more often.
Is that because of our diet, do you think?
You know, I don't think that we've really come to a reason exactly why that is happening, but I do encourage people to start, eating very healthy, a well-balanced diet, and avoiding smoking cigarettes as part of a healthy way to just live and to prevent colon cancer. But most importantly, get your colonoscopies.
What are some of the symptoms that people need to know about when it comes to colon cancer?
Well, the bad thing about colon cancer is when we start to have symptoms, it's usually when the cancer is very advanced. So really getting your colonoscopies ahead of time, taking out polyps before their cancer is the most important. Other than that, eating healthy, exercising regularly, and not smoking are great things to do.
So you wouldn't feel anything per se or have a lot of overt symptoms and feel like that's why I got to go in. The symptoms are more silent than that.
Exactly. They really are. And sometimes they can be nonspecific. Sometimes you can see blood in your stool, and that's a red flag warning sign. Let's talk to your doctor. Go now.
Well, you mentioned some of the things we can do to prevent colon cancer. So it kind of stands to reason then the people who are at risk then are people who smoke, people who are overweight, people who have a diet that's probably heavy in processed foods.
I would say that's true. But at the same time, we're really all at risk. This is the third leading cancer killer in both men and women. Nobody isn't at risk. Women can't think that this is a mainly male disease. It really affects everyone.
It's true, because I feel like I feel like women talk about it a little less. Men are sort of like, yep, is there a reason for that? Was it at some point thought to be more, male focused, I guess?
I think that perhaps the women are just not as comfortable talking about it. And really, I think that that's one of my missions being a female in this field, is that we really need to get the word out. If you've had a colonoscopy and it was a good experience, which most people are very positive.
Because you're out, right?
Yeah, you're out.
You don't feel it.
Exactly. It's people actually have some amazing dreams when they get the anesthesia.
No, you know what? This is true. My mom, she's out of town, so I can say this.
So you can talk about it.
Watching, so I can talk about her, she actually looks forward to them because she
Stop
said,
it.
I swear,
Really?
I swear, she actually likes the fact that you go through the process of cleaning out your colon, but then how she feels after. She said she has the best nap and sleeps all day long, and she said it's not bad. You know,
most people have a very positive experience, and if we could just get people to talk about it a little bit more, I think that would be great.
But our producer just said in my ear, she said her friends are still watching though. Sorry, Mom. Sorry to all your friends. But a lot of people fear the prep part of it. I mean, and I think we're so good at getting regular pap smears. I mean, I have a mammogram every year, and I have since I was 40, for example. So I think the thing is educating people about the prep, that it's not that bad, especially if you're using a sports drink, that people don't mind drinking. Because they used to, I remember, drink huge volumes of liquid that tasted
like
horrible.
A milk jug, right?
Exactly. Even the medication-wise ones are very small volume. It's really, we've come a long way, and even in just the last few years.
And is the test relatively quick?
It is. It's really about probably 15 to 20 minutes at most. If you come to one of our surgery centers or ambulatory endoscopy centers, you're usually there about an hour and a half to 2 hours, and you come in, and it's really fairly nice and
that's
quick.
great. I'm sure it is. It was great to talk to you. Some things I never heard before too. So I really appreciate the information, Doctor. And here's where you can reach GI Associates. Get your colonoscopy. If you're 40, you need it if you have relatives who've had problems, but for sure at 50. Okay, the location nearest you can find by visiting this website. It is WIGIA.com. And again, get your colonoscopy. A lot of times it's covered by insurance. So there you go. Thank you so much. Appreciate it.